Minister, I'd like to ask you the accommodation arrangements made for applicants for international protection in Galway City and County who are working as frontline workers during the COVID-19 pandemic, and if you make a statement in the matter, because this is a matter that I understand is somewhere between IPAS and the HSE, but they are the responsibility ultimately of the international protection system.
Thank you, Deputy. At the onset of COVID-19 pandemic, it obviously presented challenges to maintaining the health and safety of residents living within international accommodation services, as it did for the country as a whole. In order to safeguard our residents, specific measures were put in place by IPAS in close collaboration with the HSE from the outset of the pandemic. The measures were first implemented at this time that countrywide restrictions were imposed in March and April 2020. IPAS continues to work closely with the HSE to ensure all appropriate measures are taken for the safeguarding of IPAS residents. One of the measures introduced was a HSE-operated accommodation scheme for all healthcare workers, which can be availed of by IPAS residents. Queries in relation to any premises currently being operated by the HSE for the housing of frontline workers are a matter for the HSE. A number of other measures were taken as part of the pandemic response, which include provision for self-isolation facility centres and off-site self-isolation, increased capacity to support physical distancing, ensuring no more than 3 non-related persons share a bedroom, and this is now a permanent policy in IPAS, enhanced cleaning regimes and provision of PPE to all accommodation centres, regular communications and information on public health advice to residents and centre managers, both on the IPAS website and through resident newsletters, and the cocooning of all medically vulnerable and over 75 residents. My officials in IPAS have at all times cooperated fully with the HSE in respect of any testing that public health may decide to undertake. Any resident who tests positive is moved off-site for self-isolation along with their close contacts in the centre until such time as the HSE considers that they can safely return to their centre. And the HSE operates 2 off-site facilities, and IPAS has also provided 1 isolation centre.
Okay. Minister, you seem to be saying that these applicants for international protection, because they become frontline workers, no longer are the responsibility of your department and purely of the HSE. But have you insisted to the HSE that to provide them with suitable accommodation? Because I have received complaints in relation to the accommodation that they have, particularly taking into account that these are frontline workers providing frontline services in our country.
Minister, to conclude.
Thanks, Deputy. No, I'm not saying they're not the responsibility of my department. They continue to be IPAS applicants. Their space within an IPAS, within the Direct Provision Centre, is reserved. What I was saying is that for taking up this particular scheme, it is the HSE who supplies the scheme, and the HSE who oversees the scheme, in particular the HSE who oversees the accommodation that is provided. If the Deputy is happy to, if he would refer on the complaints about the specific type of accommodation that he's come across, I'd be happy to engage with him and happy to engage with the HSE about that particular matter. And look, I appreciate him drawing it to my attention.